Welcome to a heartfelt conversation about a legacy of healing, celebrating over 40 years of excellence in healthcare with the remarkable journeys of two extraordinary surgeons.
Absolutely. It's incredible how their stories weave together years of compassionate care and precision in medicine.
Right. We're looking at Dr. Bakri and Dr. Grover, two men whose dedication transcends the operating room. Their legacies aren't just measured in surgical skill, but in the deep humanity they brought into every procedure.
Exactly. It's fascinating how the tribute emphasizes not only their technical expertise, but also their commitment to treating patients as whole persons.
Yes, it's like every patient was remembered by name and story. Dr. Bakri, for instance, didn't just heal bodies. He healed hearts as well. His mentorship, spanning generations of surgeons, really stands out in these tributes.
And then there's Dr. Grover, who combined surgical precision with an unparalleled kindness. His approach, treating not just the disease but the person, resonates deeply, don't you think?
Absolutely. He believed that medicine was not just a science, but a true art, almost like using a scalpel as an artist's brush to craft a healing masterpiece. His work has been revolutionary, pioneering minimally invasive techniques and always staying ahead of the curve.
I find it really interesting, though, that while both of them are celebrated equally for their technical skills, there's a strong emphasis on their human touch. It's almost poetic.
Right, and the tributes capture that beautifully. There's one quote that struck me. Medicine is not just about treating the disease, but healing the person. The scalpel is merely an instrument. Compassion is the true medicine. It sums up their ethos perfectly.
That quote really encapsulates their approach. It's like they knew that each surgery was also an opportunity to connect, to care, a sort of personal vow to every patient.
Exactly. And beyond their work with patients, they were mentors. Dr. Bakri, for instance, was renowned for his guidance and for instilling values of compassion and excellence in young surgeons. His influence has, in many ways, shaped the very fabric of their surgical department.
And Dr. Grover, too, with his calm demeanor and patience, teaching methods that didn't rely on harsh criticism, but on gentle wisdom. His classroom was often the operating room, and his lessons were long-lasting.
True. It reminds me of an analogy. It's like they were gardeners, tending to each patient and trainee with care, cultivating not just physical recovery, but a nurturing environment for growth. They really sowed seeds of excellence that will continue to bloom in future generations.
I completely agree. But I have to ask, do you think sometimes this narrative maybe romanticizes the challenges they faced? I mean, in such long careers, there were undoubtedly moments of struggle too.
That's a good point. While the tribute focuses on their inspiring contributions, it may smooth over the real, hard-fought battles in emergency rooms and critical surgeries. However, perhaps that's intentional, to highlight hope, resilience, and the positive impact of compassionate care.
True. It becomes a celebration of perseverance, highlighting the best of their traits in the face of adversity.
Absolutely, and the testimonials really bring that to life. One surgical resident noted that Dr. Bakri taught them that surgery is as much about heart as it is about hands.
Yeah.
This idea that the human connection is as vital as technical prowess is what makes their legacy so enduring.
And then you have colleagues describing Dr. Grover's office as a place where precision met compassion, a rare duality in high-pressure environments.
Right. It's like he managed to blend scientific rigor with an artist's sensitivity. Even in the intense moments of surgery, his calm and friendly demeanor would reassure both patients and peers.
I love that imagery. It really paints a picture of a surgeon whose hands were as gentle as they were decisive, almost like a conductor leading an orchestra of care.
Exactly. And the tributes include several moving video messages and songs, both in English and native languages, that honor these remarkable individuals.
Right.
It shows how their impact transcended language and culture.
Yes. There are tributes in Arabic and even Hindi, which highlights just how universal their contributions have been. That really underscores the cultural sensitivity they brought to healthcare.
And isn't it striking how their legacy is interwoven with both technical advancements and personal
Absolutely.
connections? Their pursuit of excellence was matched by a deep respect for each patient's unique story.
It's almost like they recognized that every life was a narrative, requiring tailored care and compassion, not just a checklist procedure.
Precisely. And that philosophy has left an indelible mark on all those who had the privilege to work with them. Colleagues describe them as the heart and soul of the surgical department, and their combined efforts set a benchmark for healthcare in the region.
And it's inspiring that even after decades, their spirit continues to influence not just the field of surgery, but the entire philosophy of healing.
Yeah, they created moments to remember. Moments of crisis turned into milestones of compassion and expertise.
Right.
Their legacy teaches us that true healing goes far beyond physical treatment.
For sure. And it makes you wonder, how can upcoming generations embody these values in a rapidly advancing medical landscape?
Well, it's like they handed over not just skills, but also a mindset where the intersection of science and art creates incredible care. Their mentoring is, in a way, a blueprint for integrating empathy with clinical excellence.
That perspective is so refreshing, especially in a field often scrutinized for being too mechanistic.
Absolutely. Their approach reminds us that medicine is, and always will be, as much about nurturing the human spirit as it is about curing disease.
Yep.
It's a message that resonates across decades and cultures.
And the testimonials really underscore how they touched lives, not only their patients, but also all their colleagues who continue to pass on their legacy through teaching and compassion.
Right. There's a recurring theme. Every surgery was a lesson in humility, empathy, and excellence. Whether it was during the Gulf War or routine operations, they exemplified the best of what healthcare can be. Even the stories of 72-hour shifts and uncompromising dedication speak volumes.
It's astounding to consider how such long hours under immense pressure only strengthened their resolve to care and to lead by example.
Exactly, and that's why this legacy is so enduring. Their contributions remind us that healing, in every sense, is a long, continuous process, a journey driven by passion, sacrifice, and a deep-seated respect for life. Their influence will undoubtedly continue to inspire future generations of healthcare professionals.
It truly is a legacy of healing, compassion, and excellence. One that has transformed not just surgery, but the very ethos of patient care.
And as we reflect on these memorable stories, it's clear that their amazing work is a testament to what medicine can become when powered by empathy and relentless dedication. Every life they touched is part of that living tribute.
I have to say, listening to these stories, it fills you with hope. Hope that this spirit of genuine care continues to flourish in our communities and hospitals everywhere.
Absolutely. And as we honor Dr. Bakri and Dr. Grover, we too are reminded of our own roles in carrying forward a legacy built on true healing and kindness. Their story is one for the ages.
Well said. Their healing hands and warm hearts have left an indelible mark on all of us, and their legacy will continue to light the way for generations to come.